Talking about turning and positioning a patient, we need to relieve pressure off of one side. Now, can we relieve pressure off of both sides at the same time?
No.
Yes, we can. We can use a special bed, the sand bed. Okay? Those are way expensive, all right?
And way heavy to push.
Yes, they are, because they're full of sand. Okay? So now let's say that Isabel here is a quadriplegic, so she can't use her legs or her arms, okay? Makes her prone to what?
Ulcers.
Pressure ulcers. Okay, she's not moving herself. She can't readjust herself, so we have to come in and do it for her. Now, it's not just as simple as just tilting her. We have to make sure that we are bending joints in the right direction, and obviously, you know, certain joints won't let us go in the opposite direction, but we have to make sure that we're encouraging blood flow and everything else. We can only, for her, unfortunately, do one side at a time, okay? So we're going to turn her towards Professor Reed, all right? Actually, no, let's turn her towards me so that everybody can see the stuffing and stuff, okay? So we're gonna pull her over towards Professor Reed so that way when we're done positioning her, she is still in the center of the bed. All right? So on 3, 1, 2, 3. Okay.
I feel like you're coming out of the bed.
Now I'm going to make sure she's got pillows, because that's what we're going to be using to position her with. Some facilities, usually like Mayo, because they got the money honey, they'll have wedge pillows and positioning pillows and stuff like that. Pillows are very hard to find a lot of times in hospitals because we have patients that we're having to turn and reposition constantly. Some patients we might be able to get away with just having 2 or 3 pillows. Others, we might need way more. Okay, it just depends. So that's why some nurses will hoard pillows.
I don't know what a pillow is.
Not that I've ever been guilty of that. Okay, so we need to support the majority of her body weight, which is going to be from the shoulders to about hip level down here, okay? So we've got a jerry pad that we're going to use as our draw sheet or our turning pad, okay? I'm going to let my patient know, because she's still functioning from here up, right? We're just going to turn you on your side. I've got control of you, okay? I'm not going to let you fall. It's too much paperwork.
Amen.
And I literally will tell my patients that. And they usually get a nice little laugh out. I'm going to turn her as one unit. I don't want to twist her spine or anything. Okay? And you know, you could be talking to your patient, or you could even be doing a nice little massage, stimulating some circulation on that back. Okay? Also, because she's on her side, what else could we be doing? Skin check. See if there's any breakdown here.
Let's get the wrinkles out there.
Right. Okay. Now, we're going to leave this jerry pad here because, you know, she's not able to tell if she needs to go to the bathroom or anything like that, so we want this to be protected. So now we can put this pillow.
We're not going to put it up here because it will make her head go like this. Okay? You want this just below the shoulders.
It's almost lunchtime.
It is. So you're going to take this pillow, you're going to take it, and some of these pillows are very poofy, so you got to let, that one's terrible. You let the air down and you will push it, slightly tuck it, and you will kind of roll it. So it makes a nice roll. So she can roll back on it to roll.
And now this entire side is pressure free for the next, hopefully, 2 hours. Okay? We still have all those other pressure points on this side that we have to be careful of, but we'll take care of that with the next turn.
Tug her out a little bit. And if she feels like she's leaning on her arm too much, he will just give it a slight tug so she can still be out and her shoulder doesn't fall to sleep.
And what I like to do for my patients, because
As do I.
I'm the type of person, I grew up with a teddy bear, and even
Same
today
here.
I still have to have something here when I go to sleep. And do that. So that way I know that her arm's not tucked underneath her.
Or it
anything
doesn't
like that.
fall this way across her face.
Mhm.
So now we still have our knees that are bone against bone, okay? So he's going to lift. I'm going to place at an angle okay? This leaves this foot open. It doesn't have pressure from the pillow. And this one is in an angle, okay? Not straight out like this. This is what kind of motion? What kind of motion are we doing? Flexion, okay? And what kind of range of motion is this? Active or passive? Passive. So you're doing two things at one time. You're actually giving them a little exercise, and you're actually repositioning your patient. Then you'll ask your patient, do you feel okay? Are you comfortable? Even though she can't feel it, she may feel some type of pressure in some places.
She might have some up on her ear here,
Mm-hmm.
you know what I mean? Or on the back of her head where she can feel things. We don't know.
She might feel like she's falling, so we may have to reposition her pillow. This part of your pennant right here is where you are going to get the pressure ulcers. That cartilage right here is always, and in the back part, smashes. You see, and that is the worst thing to try to heal.
I have my ears pierced, but how many of you guys have yours? How much blood came out when you got your ears pierced?
Not a whole lot.
Not a lot. That's because they're not very vascular. That's why they take 6 weeks for them to heal, okay? Because there's not much blood going there.
So what I would do with this pillow, as you can see, there's not much a pillow here. We would both work together and kind of take that pillow and tilt it just a little bit behind her so she feels a little better. She doesn't feel like, oh.
She's like, yeah, I'm good.
Now she's like, good night, I'll call you tomorrow.
What we used to do is smooth her shoulder.
Mhm.
I said, just take the pillow out and then turn it.
You can.
Yeah, that way you can always remember to make sure your shoulder is fixed.
Yeah, you don't want that
Plus
pillow
these
under
pillows-
this shoulder. And
Yeah,
feel like
they
they're
just
in
turn
their
it
face.
so it'd be cold on the other side.
Mhm.
exactly, I always turn my pillows over too.
Now, how many of you guys enjoy sleeping on a hot pillow?
I like that cool pillow when I lie down.
Mm-hmm.
So you always try to make them feel better.
Now I will say, she is a little wonky, but do you feel comfortable? Yeah.
She's like, come
I do this at home sometimes too.
Right? I
I'm
know,
like-
but I'm like, oh, I'll just put
Yes,
a pillow back here.
Like I was I had to position.
We do this
That's why I
for
like
coma
pillows,
patients
so I
too.
was like, I'll put some
Yes, you
ankles
will turn your
sometimes,
coma
and-
patients every 2 hours. You'll turn any patient that's had surgery, if they're awake or not. If they just had surgery and they have pins or whatever in their legs, or they just had back surgery, it doesn't matter. If the patient's unable
High
to.
amounts of pain medication.
Oh, yes, and patients that are on tons or epidural, any of those patients, you are actually going to turn them and put them in a position of comfort. They might not be able to be this high up. Maybe they just need a slight tilt. You would take this pillow and just put it at one layer, not
Instead of
roll it
doubling
up.
over.
And then just tilt them slightly. And if that's all they can tolerate, that's all they can tolerate. Okay?
Now, let's say that it's been 2 hours and it's time to turn her again, okay? All we need to do is remove those pillows, reposition her so she's still in the center of the bed, and that still counts as a turn.
Mm-hmm.
Okay, we don't have to necessarily turn her all the way over. The only exception to that would be if she has been tilted a little bit. If we discovered that she had redness here, we would want to avoid laying her flat on that. So we would just go side to side and count those turns that way. Okay? But of course, too, what else do you think we need to do after we're done doing all of this? Lower the bed, lock it.
Circulation in the extreme.
Make sure well, we've got that. Okay? Document. Document, document, document. If it isn't documented, it never happened.
Are we gonna leave them in a flat position?
Well, unless they want to.
Unless they wanna be. Now, if this patient's on reflux precautions, we put them up. How high are we gonna put them up? At least 30 degrees. She's been here before. She does this.
Now, does that feel uncomfortable as well, or no? She's like, with the feet up?
She says, I'm falling. She says, now
Right
call me
there?
after lunch and I'll talk to you later.
Because it feels like the blood is just like I don't know, down my leg.
But now you're all nice and comfy. You can probably go to sleep really good. She's all, 5 seconds from now, she's all.
I think it's lunchtime. You guys can leave.
Right?
Pull her curtain, she'll call you later. All right.
All right. Any questions? You've heard me talk about floating the heels. Anybody know how to float heels? 'Cause that's a big thing too. If we were to put her on her back, we would still need to float her heels.
You can
So-
do it here too.
Yep.
You just pull this forward, tilt your pillow, and you just have it up in the air to where it doesn't touch anything.
And it is floating. Not touching anything.
No pressure. So if they have pressure also there, you just float it up in the air.
Now, if we were to turn her on her back, how we would do that,
Are pressure ulcers common?
unfortunately,
They
and they
are.
happen fast too. Because again, they don't have that, all that extra fatty tissue to buffer it. And their skin is thin and everything, so it does not take very long. You can get a pretty decent one within, 2 hours in that time frame. But what we're gonna do here to float her, took my pillow.
What did you want?
I need a pillow. Quite popular.
Oh, pick it up.
Okay. Now, how many of you guys sleep or are comfortable with your legs like this, next to each other? No, right? Especially us guys. Uh-oh. Somebody been smoking in here?
Patient got away.
Somebody was vaping.
Yes, they were. Got a little hot.
All right. So, I am not going to position her like this either. Okay? Again, we want the skin to be open to air, circulation, all that fun stuff, but I still need to float these heels. So, we'll take the pillow and just behind the calves if necessary, okay? And again, we're floating those heels, okay? Can she still have SCDs and TED-Hos on? You betcha, okay? But we would need to check that skin as well. All right.
Do we have to worry about
Crooked,
like
crooked.
hyperextension of the knee at all?
Well, I'm going to talk about range of motion actually next. So good lead-in, thank you. Okay. Now, because she's a quadriplegic, you're probably going to have, and every time you turn your patient, whether they're quad or not, okay, you want to do range of motion because again, joints, they need the lubrication, and if we don't use it, we lose it. Okay. So the main thing is, like for her, everyone here has seen Steel Magnolias, right?
Yeah.
Okay, and they're doing the exercise, they're just doing their Jane Fonda, right? We want to keep those nice and lubricated. A couple of times throughout the shift, okay, is just good for each exercise. Every time you go to turn them, just move their joints around, because otherwise they can develop what are called contractures, where the muscle or the joint itself, it's frozen. It's not able to move anymore, okay? Atrophy is a little bit different. They usually kind of go hand in hand, but atrophy is a wasting of the muscle tissue, not having to do with the ligaments. The ligaments become less stretchy with contracture, or the muscle might be engaged in a complete flexion and stays like this.
And then
It doesn't relax.
if you don't do anything, what sometimes will happen is they get foot drop where their feet just continue to go down and down. So you would actually also do this. Just make sure it's straight up and down and bring it back, straight up and down, and then you would rotate back and forth and around. Because that ankle joint,
No, she's really gonna go to sleep.
She's looking like she's about ready to,
it's
yeah.
like when you all are done and it's gonna go night-night, you wanna make sure that ankle joint can turn. Because that is part of walking and moving. So when they are able to get up in their chair, you don't want their feet hanging off the foot pedals and just hanging down like this. So you always want them to sit like a normal, in a shoe.
And when we start noticing that on certain patients too, there's things that we can put on their feet, and they're called moon boots, and they keep the
Yes.
ankles like this, so that way they're not continuously pointing. Some places might not have those, so you have to kind of get a little,
Yeah, we usually ask the family members to
creative,
bring
that's
in high top
high
tennis.
tops, because it
tennis
doesn't
shoes.
allow for the ankle to fall,
Mhm.
okay? Or you might have to take the foot of the bed and put pillows here,
Yeah.
so that way the
It
feet
keeps
stay
it
up
up.
this way. It just depends.
It just depends on what you're dealing
Alright.
with. Alrighty.
Now that Isabel's ready to fall asleep.
Call me tomorrow, I'm gonna take a nap.
Alright, go ahead and lift your feet up for me. Alright. Any questions, guys, that you can think of?